Welcome to Bat Therapy, mental health through the lens of comics and film. Be a fly on the wall or a bat in the cave, listening in on a friendship built out of a love for talking Batman, comics, and the everyday struggle to achieve mental health and happiness.
We're your hosts, clinical psychologist Dr. Amelia Brown and educator and comic aficionado Keaton Hopkins. Don't forget to follow us on YouTube and social media and find our Patreon at patreon.com/battherapy.
This podcast is about providing education and understanding and is not a replacement for mental health treatment or support. If you're needing help, go to bat-therapy.com for resources.
All right, so Psychology Spotlight for Sinners.
Yes, let's see it.
I thought we would go with therapy with a vampire, right? So, like, one of the things, like it, yeah, I felt so clever when I thought of that.
They have to knock in order to come in for every session.
God, see, I didn't even think about that.
Oh, yeah.
So, I just find the idea of vampires intriguing in terms of therapy because there would be nuances. I mean, obviously there are nuances to any type of person or people or, whatever. But with vampires, there's just some very intriguing things that you'd have to look at differently because if you think about it, a person's like history and their development and what stage they're at in life are so important for therapy. And all of those things are thrown on their head with vampires. So I was thinking about it from that angle, but also logistically, yeah, you'd have to work at night.
Well, yeah, I was just about to say they have to, if they're an East Coast vampire, they have to have a West Coast vampire that can meet virtually because otherwise the hours will never match, right? No, they're allowed to be inside during the day, so it wouldn't be like that. We'll figure it out.
So virtual could work, or some sort of tunnel system to your office, or nighttime.
I was going to say, during the winter, they could live in those places up north that barely gets any, like 30 days of night.
Yeah, there you go. Perfect. Yeah, there would be like interesting nuances, and it's harder to find people that'll work, at night.
Yes.
So that it could be tricky for a vampire to find someone who works during a time when they feel comfortable getting out and about.
Sure.
But so the having to welcome them, I think that depends on the lore. Because so in Sinners, it seemed like anywhere they were going, if someone had some sort of claim on the building, it didn't matter if it was like a home or not. But I feel like
I come in? Right.
Yeah. I feel like other lore is more of a stickler where it has to be like someone's house or,
Well, it was, I think they had to redo this in Sinners because the housing market is so rough, right? Like they did it because otherwise the only people that can let vampires in are landlords, right? And so it was like, okay, if you're renting this property, you can come in.
Anyone in the building could invite them in. It seemed like.
Yeah, not just the owner. Yeah, that's true.
Right.
Yeah,
it wasn't just the owner. And it was also an establishment rather than a person's home. And so, yeah, it depends on the lore. I guess some people have home offices. So then you would definitely have to be invited in. But if you were in if you were renting a place.
Can they get in your car without permission?
Excellent question. Did they hit on that in Sinners?
I don't think they did. If you have a super friendly dog, can the dog bark and invite them in?
Interesting. Yeah.
Down the rabbit hole we go.
They might have to turn a dog to be able to speak dog.
Vampire there.
I know, right? There are so many different questions here. So, yeah, vampires would be really tricky because you'd almost have to take, depending on how old they are. So let's assume that you have a vampire who has been around the block a few times, who's like lived at least a few generations. So usually when you do therapy with someone, so where I work, we call it a biopsychosocial, but an intake, or there are a lot of different words you can use for it. But essentially you're trying to take a history for someone and you want to know all about growing up, their education, where they've worked, how school was for them, what their relationships are like, any cultural things, et cetera, et cetera. You're just medical things as well. You're just trying to get a lot of different information about a person.
I'm so excited for this.
So, think about it for a vampire. First off, usually you don't want that to take more than one session, but I feel like know.
All right.
I don't know how you get through all of that.
I'm ready. This is the first time. You are the professional psychologist, but this is the first time I have the answer. I know what to do.
Okay.
The psychologist needs to become a vampire. Remember, they all have like a hive mind. So as soon as they get bit,
okay,
psychologist is suddenly connected to all of them and can help the whole hive.
I don't know.
I don't
know. Remember
Ugh.
that ethics code? You might be breaking the ethics code then.
Oh, come on.
Because then you have like the epitome of dual relationships. You're like a part because if you're a part of the hive, that's like me being your therapist or being my husband's therapist, or right? Like then
Is
then
being
you're
a healthcare providing vampire automatically a HIPAA violation?
for your own hive, or
Okay.
I can't remember if that's what they called it in the centers or whatever. But so yeah, so I feel like I agree with you that being a vampire yourself would make you a better therapist for vampires.
Yes.
You would just have a better sense of what it is to be a vampire, and it's so unique. Because you know how like you go through life and you live through something and you might think back and go, oh wow, now I really understand when so and so was talking about, I don't know, something about having a kid, or being in your job for 15 years, right? Like there are things that you like get, but then like
Sympathy
when
versus empathy.
yeah, when you live through it, it just gives you these other layers, and you can even empathize, but like the level of
Yes.
empathy grows deeper, right?
Okay, yes.
So with vampires, I feel like that would be taken to like the nth degree, because this also goes into why I think it's super creepy when vampires hit on like Buffy and stuff, because you've been around for how many centuries?
Yeah.
You should be at a maturity level that like would see her as gross. Personally, I think. Right? Just in terms of like it should feel like, a 90-year-old dating a 10-year-old, or maybe even more extreme, just in terms of like how much you've lived and how that might change your perspective on life and things and everything, right? So like there are these like layers that I feel like vampires would potentially have by living generations. It would be hard if you don't have that to be their therapist.
You would think, but I feel like whenever we see vampires in culture, whether it's in movies or TV shows, a lot of the times what we see is them still acting human, still getting jealous, still being like not being in control of their emotions, like still being like, and it's very interesting because it's one of those things, like idea of immortality or just limited, like unlimited time. It doesn't really make, it seems like whenever they show on it, it gives people like this sense of like, oh, they have a lot of knowledge, but almost like the common sense or the emotions aren't something that changes as much. It seems like, Ben, part of it's the plot point. Part of it is the plot point. The 500-year-old vampire, and suddenly he's thrust into this place where these high schoolers are so wonderful, and now he's in love again, which is, like you said, really weird.
So,
yeah, I guess it makes for good TV.
That's the thing, is I think you do have to maybe like sift through the things that are good for TV versus like what would psychologically make sense. And I guess too, so there are tons of questions here. So the question of, okay, let's say take a vampire so a lot of lore says like don't turn kids, but every now and then it happens, right? So let's say you turn a kid versus a teenager versus a 20-year-old versus a 30-year-old versus, and go all the way up. So the question of so the bodies obviously don't grow up any more than they have, and they don't get younger, but more fragile people become more virile and strong. Usually any fragility is gone. And you will have like usually the younger, like even though your body is staying young, the mind does seem to age in some ways. And so there is that interesting question of like, so is structurally the brain actually able to change with vampires, and it's for some reason different than other things, or is there something else going on? Or I mean, it is an interesting question that you bring up. So we talk a lot about fight flight responses. We talk a lot about emotions. We talk about a lot of things that there's a question mark in terms of how much does that translate over to vampires. So you need to do a lot of research really to get a
Definitely.
sense of if what we do would be helpful for them. But I agree with you. There's still very much a human component. Even when you have lore where they've lost their souls or whatever, there's still very human things about them. So even in the Sinners, there are things hinting at like, oh, they can't cross over and this, that, and the other, and it's not the person anymore, and da 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 da. But obviously the vampire that was turning people, it wasn't as simple as this is just a purely like demonic, devilish beast type creature. This is still there was still a person.
Hmm.
So there's definitely something to toy around to play with there. But yeah, it's very interesting. And then you're feeding on people, most of them. And there's usually there's some sort of craving piece to it too, where you don't always have
Hmm.
full control or you have to learn how to build control and da 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 da. So that would also be a very interesting thing because um
Sure.
like once again, depending on the lore, you might have some pretty tormented vampires depending on what personality traits they have.
Definitely. I It would be interesting to see because a lot of the times, I mean, yeah, there are times where like therapy is court ordered, but a lot of the times therapy is a decision that people have to make. My question would be more than anything, what would a vampire come to therapy for? Like, what
Mm.
is their end goal? Like, and I say that as in reality, a lot of the things that humans that we go to therapy for are for things that are out of our control, or even due to a limited amount of time. Or I guess in my mind, I there's what I'm thinking about right now is, I mean, they are immortal. So vampires probably do need couples therapy, right? Like,
Oh
right?
yeah,
They definitely need to be able to understand one another, unless
I'd
it's
agree with
that
that.
hive mind thing. Then that goes into a whole nother thing. Um,
Fair. Yeah.
but yeah, there's a part of it because like family therapy, because a lot of times
Hmm.
they don't have kids. And so there's so many layers to it. We could talk about this for hours. I am
Well, here's good news for you. The good news for you is that we're going to have more vampire movies and TV shows that we talk about this season, so we can come back to this and like
yes.
get into more into specific characters and stuff. So we can come back. I think that's a great question. So, what would they come to therapy for? So, theoretically, once again, depends on the lore. Because some lores might have, random vampires that get diseases and stuff. So they
Hmm.
aren't as like perfect as they seem on the outside. But theoretically, based on what we see, I would assume that there's probably not like mental health diagnoses like disorders, bipolar
Hmm.
disorder, depression, anxiety, da, 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 da. Um, that's not always the case. But even if, let's say, great, if I become a vampire and sweet, I'm immortal and I don't have my mental health diagnoses and this, that, and the other. What could they pop? There's still, I think you brought up some good points about how therapy might come into play. So absolutely, long-term relationships, being able to
Right.
maintain those and
Yeah.
maneuver around different logistics of that. Granted, you mentioned the hive mind piece, but even so, the sinners might be an exception. They did seem one of the most hive-ish types that we've seen.
Hmm.
But most of the time, vampires aren't always agreeing with one another. And especially, they might have different clans or different generations. And so there's usually something going on there. So there's definitely relationships of any kind, family, couples, even, dealing with other clans and
Hmm.
this that, and the other. There could also be, once again, so you don't see it in the sinners, but in some places, you see some vampires that struggle more with the life of a vampire. And so I think there could be some moral injury style stuff going on with some vampires, specifically around the I now kill people.
Okay.
And
Yeah.
so moral injury, usually when we think of this, is we think of people who have gone to war and they do things in war that are not okay by civilian standards. So killing, um, or, unfortunately, there's a lot of other stuff going on, right? So there are things like torture that happen or ways that groups of people are treated during wartime. And there's all sorts of stuff that can happen where essentially what a person's done while in combat comes into conflict with who they were before. And oftentimes that really starts coming up a lot once a person returns, especially if they're going back to somewhere that's peacetime, that's not in that war zone. And they're returning to places, people, things that were there before. So I'm a different person. I've done all these things and now I'm planted back. And I've done these things that used to not be okay, but then I did them when they were okay. It's a mental twist. And so there's all this moral injury stuff related to that. And I could see something similar happening for vampires. It depends how much of the soul component is there. With the sinners, people don't seem to really take too much issue. At the same time, you do see some like human pieces near the end. They're we didn't turn you because we promised. We could turn you now so that you could keep living if you want. There were still some like human sparks in there.
Definitely.
And so just like there's variability in the different vampires, like with humans, if there were some who struggled more with, here's the killing I've done, or here's what I do as a vampire, I could see that being something that they might need to process, or if they were wanting to change it. So take the vampire stories where a vampire doesn't want to feed on humans anymore. It's like an addiction in some ways. So they might do addiction style therapy too, as a part of, this style of stuff. So those are some of the ways that I could see it going. It could also be, there's a lot of loss. Let's say you're a vampire who hangs out around humans. Really depends on the vampire.
Right.
But the people around you are always dying. Also, even if you don't hang out with people, things are changing just constantly. And there's no end in sight unless you essentially die by suicide. And so the endlessness of life, I think, could also be something. How does your sense of purpose change when there's no end point? You're constantly having to rediscover yourself, redefine yourself, find more purpose to things when the world around you literally keeps building up and falling apart.
Yeah, because one thing to think about with vampires, because a lot of the times when we see them, they've already lived for so long that like they have like vast amounts of gold or something, whatever. What if you become a vampire tomorrow? You still got to work a 9 to 5. Like you got to live somewhere. Otherwise you're going to be, you don't want to be a homeless vampire, right?
Yeah. Unless you've got vampires that take care of you. Yeah.
Right.
Yeah. And so at least in some stories, like usually the ones that fare better are the ones that are turned and then taken under the wing of whatever family or person that turned them. But you see what happens to the ones who are just left off on their own.
Right.
That's a huge change.
Yeah,
so the change to a vampire. Whew.
That's what made Sinners so appealing, because it's like, oh wow, a black man at the mercy of Jim Crow America. You know what? Let's ride this vampire wave. I will be out there river dancing in a heartbeat.
I was also thinking though too. So if you were a therapist for vampires, you'd either have to go virtual or not work with new vampires, because usually new vampires aren't as in control of themselves, or have like garnered one heck of a deal. Like let's just say you need to be a real good therapist, because if you're not good enough, they might as well just make you lunch, right?
Keep garlic on you.
There you go.
Silver nitrate.
Yeah.
What's that? Taylor Swift song "Bad Blood." Have some bad blood, maybe. I don't know. I think
so being a vampire as a therapist would reduce some of the risk factors, shall we say?
Just be drinking holy water the whole time. You don't want to bite me, right?
Yeah. It would definitely be interesting. And like, how would you get started as a vampire? Like a therapist for vampires? Like, I see it if you were a therapist and then you got turned.
It would have to be a very fortuitous situation.
Yeah.
Where like a vampire was about to bite you and you happen to hear them saying like, what's that? Is that your mom saying she was disappointed in you? Like, is that,
They
did you
just throw out
just,
one of those like gold insight moments.
yeah,
Oh
it's
yeah,
like,
there
wait,
you
wait, wait.
go.
I see right there that you're unhappy with this. Before
Yeah,
you bite
yeah,
me, can
yeah.
maybe,
They just throw out one of those therapeutic zingers,
I
and the
swear,
vampire's like, oh,
I'm already angry because I feel like HBO is going to steal this shit from us. I feel like we're sitting on a
yeah.
gold mine.
It does feel like a very True Blood moment.
I feel like we're on to something that could be
This
potentially
could be a
amazing.
great show.
Just like a therapist for monsters. Like, that would be amazing. Like,
I
imagine,
volunteer as tribute. That
yeah.
sounds fun.
Well, you already have one, like, you already have one monster that has a locked in date every month on the full moon. That's the only time he's available to me. And then on every other week, you're meeting with the human form, right?
There
Like,
you
as a
go.
werewolf, like, that would be, yeah,
Oh.
yeah.
Oh, don't you worry. My hope is that, like, for every time we hit a new creature, we need to do this. So it's like,
Yes.
okay, therapy for this. Yeah, that's a
This is
very
going to be a fun
intriguing thing for
season. This will
werewolf.
be a fun
Yeah.
season for
Right?
sure. But yeah,
I think this will be fun.
yeah, I
Yeah.
think it would have to be a very fortuitous situation. Or, like I said, it could be a situation where, as a vampire, it's something they don't really dig into, where it's like, oh, they just live everyday normal lives. They still have a 9 to 5. They have to wear more sunscreen, but
Yeah.
they still they're able to save money because they don't have to really buy groceries as much.
Yeah.
Um,
You know, I'm thinking about it. I think if I were a vampire, I would prefer a human. I think I would prefer a human therapist. Here's the thing. There's a lot of tricky bits, and you'd have to find one that can really think outside of their own box to be able to empathize enough to be useful to you.
mhm.
So it could be tricky, but there's plenty of examples of where vampires not just tolerate, but actually get along with humans. So theoretically, there's a way. It's a lot of power you're putting into the hands of another vampire to know that much about you.
Yes.
And the human has a pretty quick expiration date.
That's true.
So, in terms of feeling like you had true privacy, a human might be better.
Well, a human might be better for that, but also when you think about things in terms of trauma and going to therapy for it, and honestly trying to undo years
Mm,
of past trauma, it's going to take a while for a vampire that got turned back during the Civil War,
yeah.
right?
So,
Therapists
yeah,
might
and
need to be a vampire because they're going to have
that's a
they're
fair
going to
point.
be in it for the long
Or you
run.
need to start with the therapist when they're in training. It's like, I'm going to be your client for
Yeah,
the rest of
for
your
the
career.
rest of your days.
In
Right.
fact, I am your only client. I will see you every day
Right.
until you die. I will pay you wonderfully, but let me tell you, there's some stuff to go over.
Like, can
That's a
you
good point. A human just
yeah.
might not have enough years
Like,
for
yeah.
processing some of
Because
that
as a
stuff.
therapist, can you imagine someone, a retired soldier coming in and sitting down, and you're like, hey, so where did this all start? And he tells you the Spanish Inquisition. Like,
Yeah.
what do you even
Yeah.
say to that?
You know, I hear you. At the same time, though, how old a person is or how much they've gone through doesn't necessarily linearly line up with how long therapy is useful for them for, or how long, for therapy.
So I guess
So it would really depend.
okay. I was thinking in the sense of like trying to undo bad coping mechanisms that have been locked in place
Okay.
for
So here's the thing though. Is
hundreds of years.
exactly patterns. And so the thing is that you need to be careful, especially if you had a vampire who was very avoidant and had trouble kind of sticking to the focus of therapy and like the meat of things, because they might focus on details. Let me tell you about the specific time over here. Oh, and let me tell you about the specific time over here. Oh, and let me tell you about the specific. That can actually be an avoidance mechanism, like a defense mechanism that
Wow,
a
okay.
person has that keeps them from ding 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 what you were saying, which is what's the pattern? What are we seeing across time? yes, we need to go into some details here and there to make sure that, we're really on the same page and we're understanding, we're like processing through it. But it's more about those patterns. And so in some ways, it might not be any different.
Okay.
At the same time, though, those patterns are ingrained for so much longer that I don't know how that would change the structure of things.
Yeah.
It could take a lot longer, especially for a particularly stubborn vampire.
So what's interesting is the different kinds of treatment they would get, because since they've been around so long, therapy for them in the 50s would be very different for therapy for them now, right? Like
That's true.
because even, I mean, we talk about how medical practices have changed over time, but mental health practices certainly have. Like that same
True.
vampire would have been like, 100 years ago when I had a headache, they just gave me cocaine for it. What is this aspirin we're dealing with
Do we
now?
think that a vampire could have ended up lobotomized?
It wouldn't have been permanent.
Or would it? It really depends on. Yeah, I guess it would heal.
It would heal. It wouldn't be permanent.
They get some exorcisms. Those might sting because you have holy water involved.
Right? Or like, yeah.
Yeah.
Or yeah, I don't know how that would go, right? Because I mean,
and so here's
electroshock therapy, things like that.
yeah. And so here's the thing. So I was saying, okay, we probably don't have mental health disorders. On the flip side, though, let's say you've got vampires and they're all elite, right? Okay, elite health. We tend to always look for variability. So so what could happen is very small differences could end up seeming like a disorder or an issue. If a vampire veers even slightly within this like high epitome of, right? So they could potentially then resort to all the same things that humans were doing to each other when it came to mental health as we kind of go down the road, medications, surgeries, therapies, etc.
Right.
But it's just like to humans, we'd be like, what are you talking about? There's no difference here. But because we're just always looking for that variability. So if they're all at the epitome, it's like you've got gymnasts and then you got Simone Biles, right? She's like clearly like whoosh different than the others, even though they're all really great.
Right.
So I think the same thing might be true for vampires. So their whole sense of what is like mentally healthy could be like very interesting.
Yeah. Like, yeah. Oh God. Because imagine if you had seasonal affective disorder and then got turned into a vampire. You just have it all the time. Like you just, oh no, like a permanent vitamin D deficiency. Like, what is this? I don't like it. You know, no.
Avoid the sun most of the time because of my pale skin. I would adjust really easily.
That's funny. It's like, actually, I was avoiding the sun long before I was ever bit.
It'd be great. But yeah, like there's, I think what could be interesting for the therapist too, especially if they're not a vampire themselves, is that within the vampire community, what is seen as standing out or like a disorder or an issue of some sort would potentially even be imperceptible to humans.
Yeah.
Because once again, so physically, mentally, they're, at this high up point, but there's still gonna be some variability. I mean, even in the hive mind that you had of the sinners, their bodies are still different. I mean, they're still in the bodies that they were in before.
Yeah.
So theoretically, there are other differences that come with that.
Absolutely. Because
so
certain
it's just
things like
interesting.
probably present themselves differently. Like, oh, he's manic. No, he's hungry. Right. Or like things like that, where you would normally look at someone acting a certain way or presenting certain symptoms, but it means something completely different.
Yeah.
As a vampire, it's like someone gave him garlic by mistake. Like,
so like in The Sinners, for example, the vampire, was it Smokestack? I forget.
Mhm.
I forget which one got turned.
Stack.
Stack.
Yep.
So Stack promising and agreeing not to turn somebody. Would other vampires see that as like normal? Or would it be like, whoa? Who knows?
Yeah.
I mean, they didn't delve into that, but those are the kinds of things I would wonder about is subtle things could be really huge deals to vampires if they're so used to being so similar to one another. Kind of like if you went to a school that had uniforms and, you tie your tie slightly different than everyone else. It's going to stand out. When if you were in a public school and you had something that subtle, no one would notice. They'd think you were dressed like everybody else, right? So yeah, it would be, I don't know, very interesting to be a therapist for vampires.
Sure. I love that.
Thanks for nerding out with us. I'm clinical psychologist Dr. Amelia Brown.
And I'm educator and comic aficionado Keaton Hopkins. Check out my TV and movie reviews on YouTube at Team JBS. Check out our website at bat-therapy.com, our Bat Therapy YouTube channel, and follow us on social media. And don't forget our Patreon page at patreon.com/battherapy. See you next week. Same bat time, same bat channel.